So a new survey from the Associated Press shows that the majority of older Americans are ready to give virtual healthcare a try. And we're talking about 9 out of every 10 adults over the age of 40 who said they'd be comfortable with using at least some kind of telemedicine for themselves or an aging loved one. So how do your patients feel about this? Are they been hesitant, or the majority of the time they're okay?
Most of the time they're okay. As I mentioned earlier, we've seen upwards of 100,000 patients in the ICU now, and you know, in the EICU, the patients are always very receptive. There's very few that ever are afraid of this. Even the older population today is very familiar with mobile technology and cameras and computers, so people become a lot more comfortable with this. It hasn't been an issue. Actually, it was probably a bigger issue with when we first started, with some of our nurses who felt that Big Brother was watching in terms of supervising what they were doing. They quickly got over that, but it was actually easier received by the patients, actually, than some of the staff in the very beginning. And
so when you first heard of this, which was how long ago?
Ours came into existence in 2006. I had known about this type of technology since the mid-1990s.
And were you some of the first on the grid with this?
We were, I would say, early adopters to the system, not the earliest of adopters. As I said, the system started in the mid-90s. We were investigating and negotiating with the company that provides the service as early as 2004, and it took about a year to set up the technology and the infrastructure to get this going. We actually went live in December of 2005 for the first time. But many hospitals, and there was a relatively small group of hospitals in the country that were using these systems, and now there's 400 hospitals that are using these types of systems, and more that are using variations of it. Certainly, as we saw earlier, the telestroke, which is not an EICU type product, that's something that's in a very large number of hospitals today, and home healthcare services where we have off-site monitoring of patients with devices that are at home, things that they wear, where the information is telemetry back to a set of doctors and nurses, not necessarily where we are, but with some team of doctors or nurses.